In today's health headlines, bird flu has been detected in wastewater in several states. There has been an uptick in bacterial meningococcal disease and what to consider about childhood vaccines as some states loosen up requirements. Joining me is Dr. Scott Roberts, Yale Medicine Infectious Diseases Specialist and Assistant Professor at Yale School of Medicine. Welcome.
Thanks for having me, Ann.
All right, the bird flu virus has been detected in wastewater at higher than average levels. Tell us about this.
The virus known as bird flu or influenza H5N1 has been detected in the wastewater in multiple states. This is really reflecting the wastewater from the virus in cows, where it's spreading amongst a number of herds. They've also detected remnants of the virus in the commercial milk supply. So I do want to add some reassurance, though. First, pasteurization of milk kills the virus, so this is likely picking up dead virus that's not actually viable. And second, while there have been rare cases of animal to human spread, the virus still has a really long way to go before it can spread person to person.
Glad to hear that. All right, an invasive bacterial meningococcal disease that can be severe or deadly is on the rise in Chicago. Do we have a risk here for that?
Chicago has seen a slight uptick in meningococcal disease compared to the past several years. But this is reflecting a broader national trend. Unfortunately, we haven't seen the same upticks in Connecticut, but we're keeping a close eye on this. The risk of getting meningococcal disease, which is due to the bacteria that causes meningitis or inflammation around the lining of the brain and spinal cord, is generally very low. There is a vaccine available. Generally, this is given in the teenage years to people at high risk, such as those in close quarters or dormitories. But right now, we look okay in Connecticut. We are keeping a very close eye on things, though.
All right, and finally, some states are loosening up their requirements for childhood vaccines. What is your message to parents about that?
I strongly recommend parents keep their children up to date on childhood vaccines. We're starting to see some diseases make a comeback, which we haven't had to worry about in a long time. I think measles is a really good example here. This is a very contagious disease. Most children do well, but some children can die from this. And we have a very effective vaccine that really prevents measles. So with waning vaccination rates, I'm concerned as this trend continues, we'll see recurrences of some of these diseases.
All right. Thank you so much for all the information, Dr. Scott Roberts. Have a great day.
Thank you.